Welcome back. Hormones can affect many parts of the body, in particular the adrenal glands, which could cause fatigue. Here with more is Dr. Amy Lilie from BioHRT Natural Health and Wellness Center. It's good to see you, Dr. Lilie.
Nice to be here.
Now, first of all, talk about what you do at BioHRT. What can you help folks with?
Well, BioHRT is a holistic program, and depending on what you have going on, if you have a hormonal imbalance or you have fatigue or other signs of aging, joint pain, etc., there might be a program for you that we could help you with.
Now, how do you know if you have true fatigue issues where it's something with your hormones or if you're just overstressed and overworked? Do you test?
Yes, we actually have a saliva test that we give to you. You can come in and pick one up, we can mail it to you, and it tests specific hormones like estrogen, progesterone, DHEA, and testosterone, which are your main sex hormones. And a lot of times, deficiencies in those hormones or imbalances in those hormones can contribute to a lot of symptoms that we have. So we test those. You send it off in the mail. We receive it back at the BioHRT Wellness Center, and then what we do is call you. You come in, and we talk about the results. We talk about the symptoms you have. We talk about other health conditions you might have that could also be contributing to your symptoms. So we try not and have like a blindfold look at what you have, but we look at everything going on with you, and then we put together a treatment plan based on the test scores, based on your symptoms, and then we have you come back in, and we follow up, and we keep track of you, so you're not left out there in the dark with your plan.
Are many people surprised when they find out they truly have a hormone deficiency, where they were thinking, oh, I just thought it's because I'm getting older, or it's because I have 3 kids, or it's because they're like, oh, something truly is fixable. Right. I think a lot of people think, well, once you're, it's just life, but it doesn't have to be that way.
It's not. It's too bad that people have that thought that, oh, I'm aging, and so it's proper for me to have joint pain, or it's okay for me to feel fatigue because I'm 65 years old.
Right.
But that's when we started talking about the adrenal glands, because the adrenal glands are little teeny acorn-shaped glands above your kidneys in the back, and they secrete cortisol.
Oh, yeah, I heard you see TV cortisol levels. I don't even know what that means.
Is it weight
what is
gain?
that exactly?
What does cortisol do?
Yes.
Well, cortisol is really important because it allows us to handle stress, and we all have a lot of stress right now.
Yes.
So what we do is we test for cortisol levels. That tests your adrenal function. People who have a lot of fatigue, they feel like they could sleep another 8 hours when they wake up in the morning, may have adrenal insufficiency. So your cortisol levels, which allow you to handle stress, might be very low. So there could be a physiological reason that you can't handle stress and you're sweating the small stuff now when you didn't used to.
Oh, I see. So you can test for that as well. Yeah. Are they related to the hormones at all, or is that totally separate?
Well, all of our glands work together like an orchestra. And so that's why we like to take a more holistic approach. We look at your adrenal function, we look at your thyroid function, we look at your sex hormones, because they all can impact each other. And when one becomes deficient, say our ovaries become deficient as we go into menopause, our adrenals have to pick up the slack, which puts more stress on our adrenals outside of the kids and the economic times and so forth. So we can balance that out by maybe putting together a botanical tincture with herbs and try to bring them back so that you feel more vibrant and alive.
I see. A lot of folks, I think they just write it off at a certain age and think that's just part of that aging process. So men and women can come to you, obviously. It's
Absolutely.
And they come in, and do they need a referral or anything from their doctor? Or just
No, we're primary care physicians.
Primary care. Okay.
So you come right in, you can register online, you can call us on the phone, and we'll be happy to answer any questions you have and get you started right away.
And what are some of the other treatments you can help folks with besides fatigue, which I know is a huge one for a lot of us moms?
Right, fatigue is a big one, but also weight gain is important too, because when you go into menopause or as we age, it seems that it's more difficult to lose those extra 5 pounds that you gain. And you may have a thyroid imbalance that's causing you to not be able to lose weight as much as easily as you once did. So it's important to have diet programs, exercise programs, nutritional habits are important. So we have people do diet diaries so we can look at your nutritional background, so we can help you in that way. So there are lots of different things we can help you with.
And don't you find, too, that for folks who maybe go to whoever their doctor is right now, and they'll say, oh, you're fine, and they don't even test for hormone levels. So don't stop with wherever you've gone to, there may be another answer for you out there.
Right. There's lots of different answers. You just have to know where to look.
Exactly. All right. Well, if they want to get started real quick, I want to tell folks, what's the process? Do they just walk on in, fill out paperwork when they first come to see you?
The easiest way to get started is to register on the website, which is biohrt.com.
Okay.
And then you can fill in all the pertinent information. One of our representatives will call you, answer any questions you have. You can stop by the office, which is on Gold Dust and Hayden in Scottsdale. You can call us. Any of those ways would be fine.
Okay, especially the holidays are here. I think this is when all of this stuff seems to swarm on. The fatigue sets in, the stress sets in, all this stuff starts happening. So would this be a good time to get started?
This would be a perfect time to
Versus
get started.
waiting until after the holidays.
Yeah, don't wait.
Don't wait, because then
you want to have the support through the holidays.
And you want to enjoy them maybe for the first time in a long time. Thank you very much. Good to see you again, Dr. Lilie. And if you want more information about BioHRT hormone therapy, you can find them online at biohrt.com or call the number you see right there on your screen. Okay, yeah, I know somebody who definitely has enough energy for all of us in the studio today. Hi, Gail. Hi, Linda.
Hi, Lisa.